All right, so we have Zarina here today, so we have an issue. Why don't you tell us about what's going on?
Okay, well, I work out often. I'm pretty good and careful with it, but this past weekend I lifted a little bit too heavy. So I tweaked something. I felt something immediately in my back just go like pinch kind of, dropped the weights, and I left the area. And for about like 5 days now.
Okay, so what kind of lifting were you doing when it started?
I started with hip thrust, which, you know,
And you started feeling it when
I started kind of feeling it, but I was like, it's fine. Like it wasn't hurting to the point where I had to stop. But then I started doing Bulgarian split squats. So I had one leg up on the bench, and you know what that movement is, and going down and up. So as soon as I went down, all of a sudden I felt like
you felt it
almost like a
really
little
grab
shift.
on.
Yeah.
Okay, and then so after that, have you worked out since? Because it's been 5 days now.
I've been doing cardio, so just walking, because walking doesn't bother me. Stair stepper, elliptical, that kind of movement doesn't bother me. It's when I'm sitting, it's very uncomfortable.
So you're sitting right now?
Yeah.
How bad is it when you're sitting right now? Scale of 1 to 10.
Probably a 9, 10.
Okay, and you're just being a trooper for this
I am.
video. Okay, good. Why don't we have you stand then, and then we can kind of just do some range of motion, see how well things have been in twist and moving. So go ahead, touch your toes to start. Okay. What are you feeling there?
My left lower hurts.
Okay.
Like right here.
Stand up. Good. And then any pain coming up?
Not up, going down.
Come over this way. And so, no, you're good here. Sydney. Okay, so do it again. Good. And come on up. Yeah, it's really tight right through there. Okay. Just bend forward at your waist a little bit. You're pretty stuck. This is kind of rising as you're bending. All right, so what about leaning back? Any pain doing that?
No.
All good going backwards. Sideways?
A little bit.
Okay, this way?
Not so much this way, it's more
going
this
that way.
Yeah.
Okay, what about twisting at your waist?
It hurts, but it's not painful.
Okay, let's have you go face down on the table. I'm gonna kind of poke around on you a little bit. When's the last time you were adjusted?
Never.
Never?
Never.
Are you nervous?
Very.
Very nervous? Okay, before I do any adjusting on you, I'll let you know, okay?
Okay.
Scoot down towards your feet a little bit. There you go. All right, so I'm just checking your leg length here. I want to see if there's any different side to side, okay?
Okay.
So in looking at your legs, one is appearing a little bit shorter, pulling shorter, and that's probably because of the muscles being all tight around the hip. Does this hurt?
No.
Okay. So even just when you're laying there on the table, I can kind of see a little pattern. So you can kind of see this is pulled back on this side a little bit. It's like this glute fold is kind of sticking up.
Okay.
You may not be able to feel that, but do you feel like you're laying flat right now?
Yeah.
Yeah. Is this uncomfortable laying like that?
No. This is how I've been sleeping.
Just face down?
Mm-hmm.
Tender here?
Yeah.
All the way over?
Yeah.
Yeah. Okay, what about here?
That feels better when you
When I press there, that feels
yeah.
better? Okay. What about here?
No.
Here?
No.
Here?
No.
Okay. Okay. Flip over on your back. We'll just test a couple more things. Any shooting pain down the leg at all?
If I'm sitting.
Where does it shoot to?
Just like down the back, I guess.
Okay.
It's mostly when I'm sitting for too long.
Any old injuries that you kind of similar to that or not really? Okay. Any pain with this?
No.
Okay, good. Relax. I'm going to cross it up and push down. Any pain?
No.
Okay. Same thing this side. So here we're kind of doing a straight leg raiser test, seeing if there's any sciatica, any pain with this?
No.
Okay. And then a little bit of a Patrick's test, testing the SI joint. So come on up. So what I want to do then is I want to go ahead and actually adjust the hips and pelvis.
Okay.
Okay?
Okay.
Are you good with it?
Yeah, let's do it.
All right, let's do it. So since we're in here, we can just use this table. I'm gonna, this table, just kind of give you a clue, is a drop table.
Okay.
So some of this may kind of push up when I kick this lever here, and then it'll drop down and make a loud noise.
Okay.
Okay? Let's have you go face down to start one more time. Did something just pop on you?
I don't know, probably.
Are you crunchy?
So crunchy.
All right, so we're gonna start through here and try to work around this first, and then we'll kind of address this.
Okay.
So do me a favor, take a deep breath in, and all the way out, let it go. Let go, let go. Just gonna push out. Good. Did you feel that?
Yeah.
Yeah, it was a little crunchy. Okay, we're gonna go a little higher on your deep breath. All the way out, let go. Good, good. Cool, so let's get down to here now. Let's have you face me on your side. Okay, I'm gonna bend this leg. Bring you closer. Well, that worked.
So crunchy.
So crunchy. And then head back, perfect. Crossing you up in a little roll. I gotcha.
Oh my god.
Good. One more. There it is. Flip the other way. Good. Scooch forward towards the edge. Good. Same thing. I gotcha. Head in the middle. And a little roll. You're not going to fall, I promise. Good. Great. Come on up. I want to test this and have you sit down. So go ahead, grab a seat. A little better?
Yeah.
What's the pain at now?
Probably like a 7 still.
Okay.
I don't concentrate. But I also took ibuprofen this morning, so I don't feel it as much as I normally would.
Okay. Was it the same level of pain when you sat down
No,
to talk?
this is better.
So it's going to continue to get better and better. By tomorrow, it should be about 40 to 50%, I would think.
Okay.
Okay.
I love that.
It's always a little bit of a process when you start getting adjusted
Yeah.
too. But it's a good start for something like this. Let's have you stand up. I'm going to just recheck your range of motion too. What about bending forward?
I still feel a little soreness there.
Okay. Go ahead, face down one more time. I want to double check you. All right, I'm going to have you lift this entire leg up off the table. Good, back down. Do that 10 times.
You lost count.
That's good, relax. I'm going to hold some pressure here. Just deep breathe. Good, how bad is that? Feels good?
Yeah, it feels good.
Good. Yeah, so your joints are moving now, but your muscles haven't caught up yet.
Okay.
So, does that feel okay?
Mm-hmm.
Good, just breathe.
Oh, yeah.
Is it shooting when I press there?
A little bit.
Good, keep breathing.
Oh my god, yeah.
Takes your breath away, doesn't it?
It really does.
It's crazy. All right, breathe again. We still got that mic on you, don't we?
Yes. Just gonna hear a lot of breathing. Just realized that.
So I'm going to pull that thing out for you real quick. Thank you. Yeah, it's just bound up right here, so I'm just trying to release it a little more. Lift that leg up again, the left leg. Good. A few more times. flip over on your back. If you're walking crooked or you're lifting crooked, which means you're imbalanced.
Oh boy.
Right?
Should have seen you sooner.
Can I poke you around your hips here a little bit? So there's a muscle in here. It's called your psoas. How's that feel? Doesn't hurt? Okay. You didn't just eat, did you?
No.
Okay, good. No tenderness?
A little bit, yeah.
Okay. Is it shooting anywhere or just staying right there?
Towards the back.
Okay. Can you handle it?
Yeah.
Okay. I'm just going to hold some pressure here. Keep breathing. Nice deep breath. There you go.
I think once you give birth, you can handle it.
That's what I hear. Y'all are way tougher than we are. Good. Keep breathing. Yeah, your 10 out of 10 pain is like a man's 5. But they always compare kidney stones to childbirth.
They do, yeah.
But I've seen some people with kidney stones and they're not that bad.
You've seen them?
They're like, yeah, I just had a kidney stone removed. I'm like, oh, you had a kidney stone? They're like, yeah, I didn't really feel it too much. I'm like, oh, okay.
They have to pass it though, right? They can't just remove it.
Sometimes. Sometimes they have to surgically remove it.
Yeah. It's hot.
What is that? It's a little more of that deep muscle, that hip flexor. Good. That is iliacus. It's a different muscle. Tender or no?
Yeah.
Keep breathing. Is it shooting to the back at all?
Yeah.
Okay, I'll give you a break. Let me help you up. Come on up. See how that feels? Shake it off. Move around a bit. Still getting a little better?
Yeah.
Yeah? What's it at now when you're sitting?
I don't feel it right now.
Yeah?
It feels pretty good sitting.
Okay, move around a little bit. Stand, walk.
Yeah.
Nice. Did you do runway or something at some point?
No, I didn't do runway.
Okay.
I thought about doing one of those contests, bodybuilding contests,
Yeah?
but my diet sucks. I can't.
You
I can't
can't.
give up food.
You basically have to.
Yeah, exactly.
Yeah. Did I tell you I did one?
Did you?
Mm-hmm.
No way.
It was men's physique. I did it 7 years ago. Yeah, it was
Okay.
tough. Yeah, I didn't reverse diet out of it, so.
Yeah, and I couldn't.
Oops.
Give up. I mean, I eat my kids' leftovers all the time. So mac and cheese.
It makes you pretty miserable because you give up a lot for a few months.
I feel like I have a good balance right now. I lift and I can eat what I want.
Yeah. I only did it as a bucket list thing.
That's my reason, yeah.
Yeah. You should do it once then if you haven't done it, because
I
then
was
you're always
do it
going to be
before
like.
I'm 40, I wanted to get it under my belt.
Do it. When you turn 40?
Next year.
Next year. Well, you got plenty of time. I mean, you're already in shape. So.
I don't know.
Yeah, it'll take 3 months out of your life.
I'm really cranky without food.
You can still eat, but it's going to be
No, I do
boring food.
Yeah.
Yeah.
I need crumble, need burritos, you know.
Sit down for a sec. Let's double check, see where you're at.
Feels good.
Wow. Okay.
Like I'm excited about the drive back now.
Awesome. Cool. Well, that's all good then.